It's Dr. Zachary Taylor, physical therapist from Pitus Health, primary care physical therapy providers. And welcome back to another video. Just a reminder, the information discussed in this video is my professional opinion. Nothing that I say or present in this video is or shall be taken as medical advice. If you or someone you know plans to participate in physical activity, this should be discussed with your physician prior to proceeding. Today we will be discussing the tragic Achilles tendon tear by Justin Moore in what may have been the biggest game of his young life. Over this past weekend, Justin Moore, Villanova star guard, tore his Achilles tendon and has now undergone surgical repair just yesterday. So we will discuss the mechanism of injury. So as you may all have seen over the weekend, this is a sudden force plantar flexion, so pushing off the toe when you push to cut to move. So looking at this replay of the injury, you see as Justin begins to push off the right leg, immediately a snap or pop occurs, and you see a shock wave go through the belly of the calf muscle. We've also seen this in pre-COVID times when Kevin Durant tore his Achilles in the NBA final against the Raptors. We all know that ended up taking 18 months due to COVID. Villanova is heading into the Final Four. However, they will be without star guard Justin Moore, who underwent Achilles tendon reconstruction early yesterday morning. For my aspiring or current healthcare professionals, as you would see on an MRI, this would display a tendinous gap filled with edema or blood. On the x-ray, you'd see soft tissue swelling and obliteration of the pre-Achilles fat pad. Other clinical presentation would suggest the tendon is formed from the soleus and gastroc as it aids in plantar flexion. We'd see a positive Thompson test. Relevant anatomy of the Achilles tendon. This is the largest tendon in the human body. Blood supply from this is from the posterior artery, and some neural testing involved would be the Achilles reflex. This is S1 and S2 nerve roots, tibial nerve. So the most common operative technique for acute injuries is the open end-to-end Achilles tendon repair. So this rehab protocol, you start with a boot, and you ambulate in a scooter or use of crutches. So formal rehabilitation typically starts between 4 and 6 weeks. Most common in the clinic, I'm seeing people 6 weeks out from surgery. So week 0 from 4 are non-weight bearing. You're on crutches. Justin will be moving around probably with a scooter, one leg up, and then he'll be scooting around to class during his final weeks at Villanova. No active plantar flexion. There you can have active dorsiflexion to neutral, but this is just at 2 weeks and beyond. So before that, we don't want bringing the toes up in the air. Active inversion and eversion with the patient to tolerance at 2 weeks and beyond. Now, week 4, week 6, that's where we start getting into the initial rehab phase. We can add 1 to 2 heel lifts. If you look at the Mass General guidelines on their Achilles tendon protocol, they kind of display some different ways that they use the heel lift, 1 to 2 heel lifts. But during this time, you're going to continue with active range of motion exercises. You can now add active plantar flexion and dorsiflexion within pain-free tolerance. So if we're still in acute pain, we need to manage the pain first, then we go to range of motion. So some exercises like this could be toe curls with a towel. We can get a bicycle without resistance and in the boot. Justin will definitely have Villanova be taking part in some aquatic rehab during this time. Other stuff that we are looking at is quad and hip strengthening. We need to maintain all our proximal strength. No restrictions with upper body lifting. However, you need to be very careful if you're lifting dumbbells and you're moving. If you're trying to stand, that is not accepted. You cannot be standing on this foot with dumbbells trying to do a chest press. So these are some things that you'd be thinking about during this rehab protocol. Weeks 8 through 10, you may begin some gentle dorsiflexion with a towel. If you want to wean earlier from the boot, this is generally discussion between the doctor, the physical therapist, and anyone else involved in this process. Generally, if we have a limp present and we see a limp, we do not want to encourage a limp, so we're going to keep you in the boot. Generally, a limp can be weakness, but at this point, it's probably going to be pain related, so we need to get the pain down before we can move into getting out of the boot and getting full weight bearing. So weeks 10 to 12, this is where we will do a gradual progression to a shoe with full weight bearing by about 12 to 14 weeks. At this point, we generally do a small transition with the heel cushion in the shoe for about 1 to 3, 1 to 2, 1 to 4 weeks. It can really vary patient to patient. And remember, we're never looking at just one person, and we're doing a cookie cutter board across the board. Every individual, every athlete, every person, every human has their own rehab process. They have their own anatomy. They have their own way of how they manage pain and how they grow. And this growth will be part of this and something that everyone in this discussion will have to take part in. By weeks 12 to 14, this is where you can maintain getting into some more plantar flexion strengthening with TheraBands starting there. And then we're really just progressing, from putting 25% to 50% to 75% with those active plantar flexions. So doing those heel raises, active, assisted, active, and then resisted. So that will be the progression there. Looking at other NBA stars, Kevin Durant, like we said earlier, took 18 months to return to game play, secondary due to the onset of the global pandemic, canceling the NBA season at that time. But the average NBA player is going to take about 10 months to recover from this injury. I would predict Justin Moore will be back in an NBA practice in 8 months. So this is putting him at about November of next year. So we could see Justin Moore making his NBA debut January 2023. So that's pretty exciting stuff. NBA season, we're starting preseason end of October. In December, that's the baby days of an NBA season. So I think any team will still have him about on the draft board between rounds 2 and 4. I think he was about projected at a second round draft pick right now. So I don't really see any hesitation. Some say this is the worst injury in the NBA. Some say it's the toughest injury in the NBA. But if you look at Kevin Durant heading into the NBA playoffs right now, and you look back 2 years ago, I wouldn't be concerned. He's getting the best care, the best medical providers that he can get, and that anyone would get. So I think he's going to be in good shape heading into 2023. Now that takes time. So moving on to some risk factors of just a general Achilles tendon rupture. The peak age is males 30 to 40. Now, men have a 5 times more likely rate or higher incident rate than women to tear. Most of these people we're looking at, like weekend warriors, someone who hasn't exercised in a while, they go out and they play in men's league basketball. Of recent in the clinic, I'm seeing more and more of our aging population getting out. With COVID, people were outside. People were playing pickleball. So we had a lot of pickleball. That's that forced plantar flexion, cutting, lifting, twisting, pushing. And as we age, we know that those tendons are less elastic, so you have less extensibility. So if you're not getting a good 10 to 15 minute warm up on the bike or a brisk walk, and then you're going into some gentle stretching, some gentle heel raises, these are the things that you need to be doing warming up. Especially starting at the age, 25, Justin Moore, 21, 22. He's a young guy, but he's playing at highest basketball you can be playing at. So just going down, if you're not training at a high level, you need to make sure you're still warming up properly, because you see this more and more often in the clinic, unfortunately. Now, moving on to Prehab. So your basic, your four characteristics that you're looking at the prehab process is stretch and strengthen, vary your exercises, choose running on surfaces carefully, and then increasing intensity slowly. So you got to use a 10% rule when you're increasing your running and you're increasing your activity. So that means in 1 week you should not be doing 10% more mileage, 10% more activity, because you're just going to break down that Achilles tendon. You're going to get tendonitis, and if you go into some forceful when that tendon is not acting, not everything's firing all at max potential, this is where some of those injuries can happen. So some of the stuff that I like to do, emphasis is on the soleus, so that's the deep calf muscle, gastroc strength, outer calf muscle. We're talking some force absorption. I really like deceleration training, single leg, unilateral training. If you have one leg that's much stronger than the other, this is where this stuff is really just going to come right at you. Rapid force generation through the calf and the Achilles. Calf raises may seem really simple, but they're incredibly protective for the Achilles. The other thing that I like is eccentric loading, so we more use this in a tendonitis situation, but in a prehab, this is also very appropriate. So single leg squats, single leg deadlifts, soleus squats against the wall, decline squats when you're on an incline and you're holding just a kettlebell here. Ankle mobility is important, hamstring mobility is important. These are all the things that definitely can get you going on the right track. So if you have questions, feel free to reach out to me. I have a ton of experience with this stuff. I would love to help anyone who's interested. As always, like, comment, subscribe, tell a friend, tell a friend, tell a friend. The only way this thing can grow, the only thing more people can get the best wealth, which is the spread of knowledge, is how you can like, comment, subscribe. Let me know. I'm on TikTok. I'm on Instagram at Pitus Health, at Pitus Health. The link will be below in the description. Please let me know any likes, comments, questions, concerns. Let's put that down in the drop box. Smash that like button right now. Let's go.